Hey guys, welcome back to the channel. This is Nursing with Ray. I'm Ray yours truly, and as you can tell by the title of today's video, I'm going to be sharing some tips with you guys to help you pass your span of duty exam on your very first attempt. So if you're new to the channel, I am a registered nurse, a new registered nurse. I was licensed in November of last year and I started working in March of this year. So it's been a year since I did my span of duty exam and I was able to pass on my first try with 87%, which I don't think is too bad. So I'm going to be sharing some tips and tricks with you guys that will definitely help you to feel more confident going into the exam and to ace it. So without further ado, let's get into the video. Okay, so in this video, I want to focus on 4 key areas that I think you really need to, master to successfully pass the span of duty clinical exam. So the first I would say is knowledge. You have to have all the requisite knowledge, obviously, to be successful in the exam. The second I would say is preparation. Preparation is very important, and I honestly feel like with good preparation, you can get away with not having all the knowledge once you are prepared. The third thing I would say is time management. Now, this is imperative because you can have the knowledge, but your time management is bad, and that can cause you to fail. And then fourth, I would say, is your attitude. Now, I feel like we tend to underestimate this one a little bit, but it is actually quite important because you can be failed for having a quote-unquote bad attitude. Now, to talk about the knowledge aspect of things, you have to have the knowledge, obviously, to be successful in the exam. You're coming up on, your graduation, you're on the cusp of completing nursing school, so there's a certain level of knowledge that you are expected to have, right? Now, for the span of duty examination, we focus mainly on these things. Number 1 is going to be your health history taking. Okay, because you have a data sheet that you're going to get at the beginning of your exam. You have to fill out all the information on that data sheet for both of your patients. So it includes things like their biographical data, their name, age, their address, things like their social history, family history, all these different things you have to fill out on that data sheet, and it is quite a lot, so you have to get familiar with that data sheet. When I was doing my exam, I ended up getting a copy of the data sheet beforehand, and the copy that I had was a copy that somebody had already filled out, so they showed you basically how to fill it out, what to put in each slot so that you can complete it quickly. So you have to know how to take your health history. Right, the next thing is your head-to-toe assessment. You have to know how to properly assess your patient, because if you can't properly assess the patient, you can't properly diagnose them, right? And if you can't properly diagnose them, you can't properly care for them, right? So you have to ensure that you know how to do your full head-to-toe assessments. But when it comes to documentation, you are not going to write out like a full head-to-toe like you would when you were a freshman or a sophomore nursing student. You're going to be doing a focused assessment. So what that means is you're going to zone in on whatever the patient's primary concern is. So if your patient has COPD, your lung and thorax is where you're going to hone in on. So that's where you're going to go more in depth when you're doing your documentation. Okay? Now, so that's it for your head-to-toe assessment. The next thing is your care plans. Care plans tend to be a struggle for a lot of nursing students. It takes practice. You have to practice so that you can get, I wouldn't say perfect, but permanent, right? Whatever you practice becomes permanent. So you have to ensure that you are pretty confident in your care plans, because again, that is very important, because that's going to determine the quality of care that you're going to bring to the patient. Okay, so you have to ensure that you're able to do your care plans, do them well, and do them fast. Okay, because you're going to have to write 3 care plans per patient. So that's 6 care plans that you have to do. So you have to be pretty efficient. Okay, next thing, you need to know all the steps of medication administration, because in your exam, you're going to administer medication. So you have to ensure that you have practiced enough where you understand all the steps. Okay, so your verification, your first, second, third check. You have to ensure that you follow all the steps properly so that you can maximize on your grade, obviously. And then you also have to be knowledgeable on whatever medication it is that you're going to administer to the patient, because you have to educate the patient. And depending on the examiner that you have, some of them will ask you questions about the medication, things that they expect you to know, like the mechanism of action of the medication. They will ask you things like some of the side effects, adverse effects. What are some nursing considerations that you have to think about when you're administering this medication to the patient? So you also have to be up there when it comes to your pharmacology, right? And then last but not least, your dressings, right? So for span of duty, another big part of it is doing a sterile dressing, and this can be difficult for some people. And again, it takes a lot of practice. You have to be practicing your dressings, right? Dressing was probably the hardest part of span for me, because I feel like I wasn't as good at dressings. I was really good at care plans, and I was good at medication administration, and my health assessment and all was good, but dressings, I don't know, like I would feel like I have it at one point and then I lose it. So it was definitely something that I had to pay more attention to. And so I implore you, practice your dressings at home. Practice them on your family, your friends, your classmates, your teddy bear, your dogs, your cats, everybody. Practice, but ensure that when you're practicing, there is somebody there to guide you and to make you aware of any mistakes that you make, right? Because if you keep practicing the wrong thing, you're going to go into the exam and you're going to do the wrong thing. Okay? Now that's it when it comes to knowledge. Once you have the knowledge, I feel like you're halfway there. Okay, once you know everything or most of the things that you feel like you need to know for the exam, then you are halfway there. Now, the next thing I want to talk about is preparation. Preparation is very, very important, and this will save you, okay? Depending on the school that you attend, you may or may not know when you will be doing your exam. Now, for me, I attended the Northern Caribbean University, and so I did not know when I was going to do my exam, because according to them, by right, according to the Nursing Council, you're not supposed to know when your exam is, okay? So we basically just went in blind, not knowing what day we were going to have span. Okay, if you're from another school, then you're fortunate. You'll know when you have your exam and you can be better prepared. But even if you're an NCU student, there are still little ways that you can go about it and know when you're going to have your exam. Okay, so usually they go one hospital per day, right? Usually span will start on the Monday, the first day. Usually nobody will have exam on that day. They will actually start on the Tuesday. They will give you that one day to get familiar with your area, okay? Get familiar with the unit that you're on, get familiar with the patients, their conditions, and choose your patients. By right, you're not supposed to be choosing patients beforehand, but it happens. So you get that one day to get familiar with your patients and all of that, okay? Now, what they usually do is they will go to the smaller hospitals first, and then the larger ones after. And then they will just rotate, and it continues like that. So if they keep the same pattern that they usually do, you end up figuring out when you're gonna have exams. So obviously, if say for the first week you're on the afternoon shift, then you know that you're not gonna have exam in the first week, because the exam will be when you're on the morning shift. Okay, so those are the little things that you can do to know when you're gonna have your exam. Okay. Now, when it comes to preparation as well, when you're on the ward and you know that this is the ward that you're going to be doing an exam on, you need to get familiar with the patient. You need to know what the common medical diagnoses are of the patients on the unit, because even though you may be like, okay, I'm going to choose these two patients and these are the two patients that I'm going to use for exam, you never know what can happen, because some examiners can be quite hard, for lack of a better word. And some of them, if they feel like you did too much preparation beforehand, or you come off a little bit smug, like, some of them will switch your patients. They can do that. So even though you have your two patients and you're going to prepare and learn as much about them as you can, be prepared for your patients to be switched, because it can happen, right? And then as we're talking about switching of patients, you also have to be very careful with the patients that you choose. You do not want to choose a patient that is too ill. for obvious reasons, because it's going to be a little bit more difficult for you. Your notes are going to have to be longer, your interventions, all that stuff is just going to make your life a lot harder than it needs to be when you're choosing like a category 4 patient. Okay, you also do not want to choose a patient that is not that ill. Like, you don't want to choose a category 1 patient. Number one, that's going to make it harder for you too, because when patients are too well, it's hard for you to find nursing diagnoses for them because most of their problems have resolved, right? And these patients are just about to be discharged. So it's going to be very hard for you to write your care plans because you're like, the patient has no problems, you know? So that's one thing. And then the other thing is, sometimes if your examiners notice that your patients aren't ill enough, they will switch them and give you a more complex patient. So when you're choosing your patients, try to choose category 2s and 3s. Also, when it comes to choosing patients, you do not want to choose patients that are mentally ill, okay? Because they're unpredictable. You never know what they could do or say to mess up your exam. You don't want that. Choose patients that are cooperative. Obviously, it's your exam day. You need things to go as smoothly as possible. You need to talk to your patient beforehand. Your patient needs to know that you have an exam tomorrow and you need their cooperation. Okay, this is the time to put all pride aside, sit the patient down and say, look here, sir, mom, we have exam tomorrow and this is what I need from you. Inform them that they're going to be people that are coming, they're examiners that are going to be coming there and observing them while you're carrying out, you know, care, right? Tell them that examiner is going to be there. They're possibly going to ask the patient some questions, you know, inform them so that they know what's happening and, you know, so that they will work with you to make your life easier. Now, when it comes to preparation as well, you want to ensure that certain things are done beforehand. You want to have what we call a span box. So this span box is going to have a lot of your little essentials in it. You start to pack this box from before you have your exam, like probably like a week before or whenever before. Whenever you're in the clinical area, you pack this box. Okay, you're in the clinical area, get yourself some sterile gloves, because you should have been getting them to practice your dressings from beforehand. I don't care what nobody want to say. You are a student nurse and you are providing a service to these hospitals. Even though you're a student, 2 sterile gloves at the least, some gauze pack at the least, 1 bag of saline at the least. Take them. Take them and practice, okay? And get your little box, put a bag of saline in there, put some gauze packs in there, put some sterile gloves in there, ensure that they are your right size, put some syringes and needles in there, get a roll of tape. Tape is very hard to come by in these hospitals, especially the broader tape that you need for your dressings. Get those tapes. Ensure that you have your scissors and stuff to cut your tape. Ensure that you have all those little things. You need a clipboard because you're going to be writing a lot. You're going to be getting a lot of different papers and you can't have any books or anything to press on. Get yourself a clipboard so you can clip all your papers on, keep everything organized, and be able to write. Get yourself a clipboard, okay? So these are some little things that you need to prepare and ensure that you have them beforehand. Get to the clinical site early. Your exam starts at 7. You need to be there at like 5, to be honest. Me, I was intending to get to my exam at 5. I got there like 5:30, 5:45, thereabout. Get to your clinical site early, okay? Ensure that certain things are done for the patient beforehand. So if the patient needs a bath, ensure that the patient gets a bath. Look at your patient, ensure that they have clean clothes on, ensure that their hair is, you know, relatively groomed. Their nails, if the patient has long, dirty ass nails, cut them, clean them, because these are things that your examiners are gonna look at and you will lose marks for stuff like that. Okay, when it comes to things like space for your dressing, sometimes the wards, they can be very overcrowded and you don't have a lot of bed space, but you know that for your dressing you need adequate space. Get there early and move the beds around. Push some of them away and make more space between your patient's bed so that you can have space to put your trolley in and do your dressing properly. Also, when it comes to trolleys are hard to come by. Try to find one beforehand and stash it away somewhere. Hide it. you will need it for your exam day. A lot of times the trolleys, they're very dirty, they have a lot of old tape and stuff like that. Before your exam, you need to find a time to clean that trolley down, get off all the old tape, scrape it off, all that stuff. We ensure to do that the day before our exam because you need to ensure that your trolley is clean. Now, other things that you need to ensure that you have before the day of your examination are: number one, your patient's treatment chart. Because you're going to be administering medication, you need the treatment chart, you need the medication administration record. Ensure that the patient's treatment chart is available on the ward so that exam day you're not running up and down. Okay? Ensure that you have them. Next is your dressing order. This is very important. Get your dressing order written from the day before. Take it home with you if you need to. I did that. So that, actually, I didn't do that. I gotta be careful what I say on this here internet. But, you know, do what you have to do to ensure that you're successful in your exam. So get the dressing order written and ensure that you have it for your exam. So when it's time to go, you can just flow smoothly. Also, you need to ensure that your patient's medication that you'll be serving is available on the ward. You're going to be doing exam in the morning, so whatever once daily meds the patient is on is what you're going to be serving. So you need to see what the patient's 10 o'clock medications are and ensure that you're familiar with them. Most of the time it's going to be Omez or Pantecta or whatever, one of those PPIs. Ensure that you're knowledgeable about the medication and that it is available on the ward with the patient's name on it. So if you don't have any with the patient's name on it, you need to find yourself down to the pharmacy, because that's what I did. I took my patient's treatment chart, I found my way down to the pharmacy, and I ensured to get the medication for my patient with their name on it, right? If you need to stash it away, hide it away somewhere on the ward so that the nurses do not use it, do that so that you have it when it's time for your exam, so you don't have any hiccups, you're not running up and down and wasting time. You also need to ensure that your patient doesn't have any procedures or anything that they need to go do, because again, that can really mess up your exam. So like I said, choosing a patient that is too well and about to be discharged is not a good idea, because your patient can literally be discharged in the middle of your examination. That happened to a colleague of mine, and he had to choose another patient because his patient got discharged at like 8 a.m., like an hour into his exam. You get me? You don't want that to happen to you. You don't want to choose a patient that is about to go to surgery. You don't want that to happen to you, because you would have already started and done so many things for this patient. The patient has to leave, and guess what? You have to start over your exam with a different patient. You don't want those things to happen to you. And I mean, even the worst thing too can happen, like what I said about choosing patients that are too ill. Your patient can die in your exam. You do not want that to happen to you. And I mean, technically it's not something that you can predict, but you know, it's more highly likely the more sick your patient is. So don't choose patients that are too ill. Now, this is something that you could possibly do. I knew where I was going to have exam. Based on the pattern and everything that I saw, I knew where I was going to have exams, right? And I realized that I had days off before my exam. So I had the weekend off, and then my exam was supposed to be on the Monday. And that was not the ward that I was previously on. And so I would basically be going into my exam blind, because my first day on that ward would be the day I'm getting an exam. And I was like, hell no, that ain't gonna happen to me. I found myself to that hospital on the Sunday. I found myself over there, and I worked the Sunday. Even though the Sunday was supposed to be my day off, I worked that Sunday so that I could get familiar with the patients, choose my patients, sort out my patients' medications, get their dressing orders done, and get everything done for my patients as much as I could the day before, because I was not going to go into that exam blind. And so you have to know what to do to ensure success for yourself. Okay? This is something I should have touched on when we talked about knowledge, but you need to be very familiar with the SPAN checklist. And I mean, I guess it does come under preparation too, right? The SPAN checklist, you have one for medication administration, you have one for dressings. You need to know those checklists like the back of your hand, because that is what they're going to be using to grade you. So when you are practicing your dressings, that is a checklist that we have, and we're going through and we're taking off things and we're ensuring that we don't miss anything. You have these things that we call asterisk points. They're very important because one asterisk point missed is an automatic failure. Well, not missed, but you have certain things on the checklist that are asterisk points. So if you don't meet the requirement of whatever that asterisk point is, you automatically fail. It doesn't matter. It doesn't matter how well you were doing. Once you mess up on that particular thing, you fail right off the bat. For dressings, I remember one specific asterisk point, and that is do not leave the wound uncovered for more than 5 minutes. So if you take the old dressing off the wound and you're there and you're doing all sorts of things, and then 5 minutes passes and you don't start to clean the wound, you automatically fail. Okay? So you need to be aware of the asterisk points and ensure that you're doing what you need to do, because there is no coming back from that. Now I want to talk about time management. Like I said, time management is key. Okay? You have to sit down and really plan out how you're going to do this thing, because time is very, very important. You need to get your skills out of the way first. Okay, so when you come, you're going to fill out your data sheet, receive your patient, write up your assessment, and then go do your medication. Go do your medication. Once you're done with your medication, go do your dressing. Once you're done with your dressing, then you can come back, you can sit and write your care plans and update your notes. Get your skills out of the way first. Okay, because you will spend all day writing, and then the exam is just about to be done and you haven't served meds and you haven't done your dressing yet, and that is where you fail. Get your skills out of the way first, and then you can sit down and do the bulk of the writing after. When it comes to your dressing, you know you have 30 minutes to do your dressing. If you have been practicing coming up all this time, you should be able to do a relatively simple dressing in about 15 minutes. 15 to 20 minutes. Now, when it comes to your dressings, you don't want to be choosing patients with stage 4 ulcers and stuff like that and huge wounds. You obviously don't want to do that. You want to choose something that is manageable, that you will be able to finish within the 30 minutes time frame. When you're choosing your patients to dress, it does not have to be the 2 patients that you're using for your exam per se. Like the 2 patients that I used for exam, none of them had wounds. But there was another patient on the ward that had a wound that was a patient that I ended up doing my dressing on. I'm not sure what your school's rules are surrounding that, but I was able to do a dressing on somebody else. So try to find wounds that are small enough, but not too small, because if it looks too small and too simple, like it's just going to be about one wipe, they're going to tell you, go find somebody else. As it relates to your care plans, you need to be writing your care plans fast. It's a lot of writing. Your fingers are going to hurt by the time the day is over. I had a dent in my middle finger for like 2 weeks after span because of how hard I pressed on that pen and how much writing I had to do that day. You're going to be writing a lot. You need to be able to finish a care plan in like 10 minutes because you have 6 of them to write. So it shouldn't be taking you more than an hour to get your care plans out of the way so that you have all the other rest of time to get your skills and stuff done. Okay, so ideally you want to be doing a care plan within 10 to 15 minutes. Ideally 10, because you have 6 of them that you have to do. Now, you can still pass span without doing all 6 care plans. Yes, you can. Time finishes on some people and they didn't get all 6 done. They maybe got 5. Some people got 4 done. And they were still able to pass, but you have to ensure that the 4 that you have are really, really strong, well-written care plans, and you will pass. For me, I finished all 6 of them. But, like I said, there are people who pass with less. So once you know what you're doing, you can finesse it. Now, something that I would suggest you guys do, print out the data sheet beforehand so that you're familiar with what is on it and you know what the patient's information is. So when you come on the day of exam, you don't really have to go and ask them nothing because you already know what's going on there. So you're just rewriting, right? You're just rewriting because you've already spoken to the patient, you've already filled it out, you know what's to be on there, so you're just writing. And it saves you a lot of time. Even when it comes to your nurse's notes, receive your patient beforehand. Do your assessment on them beforehand. Every day when you come, receive that patient every day. So when you get there on the day of exam, it's like muscle memory for you. You're just rewriting, unless there has been a shift in the patient's condition, like something drastic. But for the most part, that really, really helps you to save time. And then last, but definitely not least, I would say, is attitude. Now, people, like I said, underestimate this area a lot. You can be failed for having a bad attitude. I believe that is an asterisk point. And there was a batchmate of mine who was failed because of that. I guess the examiner didn't like, I don't know, the way she was speaking, the way her facial expressions, I don't know. But she ended up failing her because she said that she had a bad attitude. So you have to keep your emotions in check. It's going to be very overwhelming, and sometimes people cry. Do not cry. Don't cry. You're going to get to points where you feel overwhelmed. Some examiners will do that on purpose. They will purposely try to get you flustered and try to just cause you to feel overwhelmed and feel like you can't do it. Don't give in to them. Don't give in to them. Because there are definitely some examiners that are sent from hell, and they come to give students just that, hell. But you just have to be confident in what you're doing and know that, God did not bring you this far to leave you, and you're not going to let them be the reason why you have to resit this exam. Okay, so you have to be very cognizant of your attitude. Be respectful. Even when you're getting overwhelmed and flustered and, they're being difficult for no reason, be respectful. Try to remain calm. Don't get flustered. Take some deep breaths. Excuse yourself for a minute or two if you have to, but you have to keep your attitude in check. Ensure that your facial expressions are, pleasant, and your tone of voice, the way that you're speaking, comes off with respect. You gotta kiss a little ass before you can kick it, right? And I usually don't subscribe to that statement because I'm always saying, nah, do that. But when it comes to this exam, people, you gotta do what you gotta do, okay? So you have to keep the attitude in check, because some of them come in just looking for any and anything to fail somebody, okay? Some of these examiners, they are brutal, and they come in with the intention of failing people. But on the flip side, you have examiners that come in and they don't want to fail anybody. They come in with the intention to pass everyone. And that is why you need to pray. I prayed in the week leading up to my exam to God for me to get good examiners, and He answered my prayers. The examiners that I got, oh my God, they were the best. Two of them were two that I was familiar with. One was a lecturer from my school. The other was a preceptor that had been precepting me right up until that point. And then there was another examiner, external, and another one that I didn't really know, but I think she was precepting some of the students at a particular hospital at one point, and they were just amazing. They helped me throughout my exam. They helped me to keep track of time. They were like, okay, it's this time. Come and get your medication done now. They're like, okay, where are you with your care plans? XYZ. Some of them will even help you. You're stuck on an intervention, they might give you a little hint. So you really need to pray. Trust me, because the examiner that you get for this exam can make or break you. It really, 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 really can. So I feel like putting God in the middle of it is also very, 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 very important. Now, the hospital that you're placed at for your exam, I think it also plays a little bit of a factor, because some hospitals, have more resources than others. Some people tend to say that the hospital that has the most resources is not necessarily the best place to do the exam, because they will say, oh, they will mark you harder because all the resources are there. I don't know how true that is, but everybody has their different experiences. And the nurses, some of the nurses at some particular hospitals are way more helpful than others. Some of the nurses will ensure that they prepare certain stuff for you, and if they see that you're overwhelmed or you're flustered or you need a little help in whatever area, they will help you in whatever way they can, whereas some of them will just leave you. So these are things that you just have to stay prayed up about. And when you're on the unit, befriend the nurses, be nice to them. Like I said, kiss a little ass, right? Because you're gonna need their help at the end of the day. So be extra nice to them, go above and beyond for them, do what you can for them, because you never know, you might need their help on exam day. Okay, so yeah, I think that's it. But let me know in the comments down below if there's something that you're unclear about, something that you want me to further explain. If there's a question that you have that I did not touch on any at all, let me know down in the comments below. Yeah, and I wish you guys all the very best. If you go to my alma mater, I know that you guys are starting SPAN in just about a day and a half, and I pray for the best for you guys. If you're from other schools, I know that you guys are going to be doing it later down, so like next month to July thereabout. I wish the best for you. Ensure that you have been reading up, ensure that you have been practicing, stay prayed up, and just do your thing. You know, you got this. And I was gonna say, even if you don't pass, but we're not even gonna put that energy into the atmosphere. We're not put it out there. You are gonna pass on the first attempt. Okay? So thank you guys so much for watching this video. If you are not subscribed, please click the red button down below and subscribe, and also leave a like on this video if you found this information useful. Please share this with another nursing student. I realize that you guys, y'all are really supportive, but instead of keep the information for yourself, why? Share the information with another nursing student, another prospective nursing student, somebody out there who you think would benefit from this information. And I know that we have a lot of housekeeping and stuff to discuss because I've been off YouTube for quite a while. You know, there's a lot of updates, but I will save that for the next video. Yeah, so bye.